From 7 News headquarters, this is the latest on the coronavirus with Melissa Doyle and Matt Doran.
Well, good evening and welcome. We are bracing for a weekend like no other as restrictions across the country hit Australians where it counts.
We'll take a closer look at those measures and how they'll affect you and your family in the coming days.
A heartbreaking interview. I speak with the Australian wife of a Hollywood actor killed by COVID-19.
Can the nation's internet grid keep up with demand? With so many working from home, the Optus boss joins us.
Coronavirus cons on the rise. An expert from Australia's scam watchdog is here with the latest warnings.
And Bedtime with Dolly, the country music singer's new initiative for kids in the time of COVID.
But first, this weekend's coronavirus crackdown on so many of the things we take for granted. We're told the latest restrictions on our most fundamental and fun activities are vital to keep us safe. But what tools will authorities be using to enforce these new measures? Angela Cox has the latest.
This and this, even this, outlawed in many parts of Australia. Our outgoing, outdoor lifestyle, a victim of coronavirus. Victoria's laws are perhaps the toughest. Fishing, boating, camping, even golf. Out of bounds. All golf clubs in the state closed for at least a couple of weeks.
If it's a recreational activity, then it's not on.
And one of the most popular recreational activities all over Australia will be all but wiped out this weekend. Since the shutdown of Bondi 2 weeks ago, one by one, beaches around the country have been closed for business. Queensland, the latest to join the crackdown. Banning sunbathing, even if you're observing social distancing, because laying out is not considered exercise.
If there isn't compliance, we then have the option of issuing a $1,334 infringement notice.
Away from the beach, police have the power to fine, arrest and even jail people who gather in groups of more than 2. The laws are being enforced by patrols on foot and in vehicles. But there are other enforcement tools available, including one that you might not expect. Thousands of CCTV cameras monitor many of our public spaces. These could be used to help enforce social distancing. As governments around the world struggle to contain the virus, some are turning to extreme surveillance measures, raising concerns about how much of our freedom and privacy, things we take for granted, are being eroded by this pandemic. In China, CCTV cameras and facial recognition software is being used to make sure people in isolation do not leave their homes. It's also been successfully used to track the movement of known carriers as they spread the virus. In South Korea, CCTV is also helping to identify people who've been in contact with COVID-19 patients. And there are reports the UK government has begun using anonymous smartphone tracking data to find out if people are following lockdown guidelines. All of this raising questions about how far Australia will go to enforce these new laws. Now, I rang around to check if police here are using their extensive CCTV capabilities to help enforce the laws. New South Wales, Victoria, South Australia and the ACT say they are. We're still waiting for replies from Queensland, WA and the Northern Territory. Tasmania isn't at this stage. Matt?
Thank you, Ange. Well, for more on this, let's bring in now Professor James Doran, Director of the Centre for International Security Studies. Professor, what is your view on the use of surveillance to monitor social distancing? I mean, just how effective do you think it might be here compared to, for example, other countries?
Well, you want as much information as possible to contain the virus. The risk, though, is whether or not the information is going to be used strictly for containment purposes. There is a long history of surveillance where there's no sunset rules. Some of the laws from 9/11 are still in effect, even though the threat's diminished. So that's one of the concerns of anybody who's thinking about civil liberties.
Phone surveillance, I guess, is the next step. In Europe, even in the UK, we're starting to see governments ask telcos to hand over location data to try to monitor whether citizens are in fact self-isolating. Could that happen here?
everyone wants to do what's best for the public good, but again, its efficacy. Is it really going to be effective in something that's not an authoritarian state, an autocratic state? And other countries which are using this, like Hong Kong and others, have used it previously for pandemics. So we're not really up to speed on it. A lot of our cameras and also our apps are geared for other purposes. So to retool rapidly, it's almost asking like, getting a vaccine in place within, instantaneously.
We're a unique breed here, I think, Professor. Australians don't seem to like being told exactly what to do. Do you think they would accept this type of extreme monitoring? I've
been in Australia long enough now to know that we don't take kindly to being treated like inmates. You don't want to create a carceral state. What you want to do is encourage people to be their best possible selves, and that's being adults, responsible, thinking out and being kind to others. And I've witnessed that. But if you just bring in a heavy hand right now, you could damage that spirit that's really keeping, I think, people together in these difficult times.
It's a tough balance to strike. Thank you very much, Professor James Darian.
Okay.
A concerning milestone was reached today. Around the world, more than 1 million people have tested positive for COVID-19 and more than 51,000 have died. Here, infection rates are thankfully slowing, but our death toll climbed today to 28. Tonight, a reminder that behind every one of those numbers is a real person. Andrew Jacks was a renowned voice coach and actor and appeared in some of the Star Wars films. He was struck down with the virus in the UK. His Australian wife, Gabrielle Rogers, was in self-isolation in Brisbane. Andrew sadly lost his battle on Tuesday. I spoke to Gabrielle earlier today. Gabrielle, I'm just so sorry for your loss. How are you managing?
Thanks. I'm sorry for everybody's loss. He was very loved. How am I managing? Oh, it depends which minute you ask. Everybody out there's been touched by grief, I'm sure. I'm sorry for your loss. It goes in waves. It's an exquisite agony, and it changes. It's a roller coaster.
Yeah. Overcomplicated by the fact that Andrew was over in the UK working. You were back here in Queensland.
Oh, yes, I just arrived back. So, sorry to interrupt you, but I'd just been stood down from my production in New Zealand, and I flew in Tuesday a week ago. So I'm 10 days into self-isolation, 10 or 11 days of self-isolation.
Oh, wow. So you're stuck at home. When did he first tell you that he was starting to feel sick?
This is the heart-wrenching stuff. It went up and down. He said he was a little bit of a sore throat, and he wasn't that hungry. And I said, that's it, you're going to the doctor, you have to go to the doctor. And he said, don't be silly, that's ridiculous, I'm fine, I'm just doing, the right things and washing my hands. We're in London, he lives on a boat on the River Thames, and so that's our home there near Windsor. And he was there and he was self-isolating and doing all the right things. And then he said, I've got a bit of a cold or something, I'm not feeling very well. And then at the end, it happened very quickly. It happened really quickly. He was admitted to hospital, and 40 hours later, he died.
Gosh. When did you last speak to him?
I spoke to him on FaceTime. Thank you, FaceTime. And I say that because it means you get to see each other, which, as we all know now, is just, thank God for the internet. We FaceTimed each other when he was in accident and emergency, or what we call in Australia emergency. I was very lucky. I did get to say to him all the things. I got to tell him, what a wife says to a husband if she's scared that she might not see him again. So we had that, and that was good.
I'm so sorry. Oh, it's just the speed. It's terrifying.
Yeah, and he was in denial those last few days at home alone on the boat, which is, of course, what haunts you. He was in complete denial. There's a network of friends and family that were FaceTiming with him. I've done the math. Nearly every day he was communicating with somebody, But he was such an actor. He was so good at putting on and he was so great at work, and he was so great on a screen. He was always, FaceTiming with his actors if he couldn't be with them in person, and so he would present so well.
Is there any chance that you will be able to get to his funeral?
No. There are so many reasons, all of them around, laws about travelling at the moment, the fact that I don't actually leave self-isolation in a few days. I haven't even appealed for special consideration, because I just don't feel that it's of any benefit. He and I have been to his burial place together when he was alive, so I was with him there in the best possible circumstances. And his son and his son's partner are handling it all that end, and I'm with them, and it will be an incredibly intimate family moment, and we will all be together and present in that moment. I'll just be on the other side of the world. And yeah, that's hard. Of course that's hard. But so is also giving somebody a disease. So I have no symptoms. I'm in rude health, but I don't really feel like travelling the world to catch it and bring it home to my children, or indeed my beautiful father and his wife. I don't want to, be that girl. So no, I won't be at his funeral. We'll do a memorial or something online, and it'll be lovely. But in a way, I think that's why I wanted to do this interview, because when you're grieving in four walls, the opportunity to connect, even if just digitally, is really great, So it's lovely to be able to say to all the people that loved his work, even if they didn't know that it was his work that they were listening to, that take care and take care of each other and stay at home and, take care of yourselves.
A really important message. Gabrielle, we appreciate you talking to us at such a difficult time, and we're with you. You've got all of our love and thoughts, and take care. Thank you.
Very welcome. Thank you. All the best to you.
Such a remarkable, so eloquent and honest at such a sad time. I think a reminder behind every number that we talk about every evening is a loved one.
So brave too, and that's the reality for so many families, being unable to be there with their loved ones in other parts of the world. Yeah. Moving on now, and to those cruise ships causing so much trouble, still floating off the New South Wales coast. Senior reporter Denham Hitchcock is live at Circular Quay in Sydney. Denham, we're told most of those ships will have left New South Wales waters by Sunday, but we just can't overstate the importance of how this is handled. Cruise ships now linked to a quarter of all Australian cases, a third of all deaths.
That's right, Matt, and that's the hope, isn't it, that they do go, but there's some serious things at play here. It is my information that on the Ruby Princess there are hundreds of crew on board that ship that are potentially sick, that are in isolation, and those crew members are being tested. So on one hand, you have these cruise ships that are floating out there, and if they all come into our hospital system, it will completely annihilate it. But then again, if we send them home and they have a long voyage home and some of them are seriously ill, then they may not survive that journey. So it is my understanding that the results of the tests that are being done at the moment, that are being tested right at this stage, will determine all of this. It depends on the level of severity of that sickness, and someone's going to have to make a very difficult call.
A difficult call indeed. That is a frightening thought. Hundreds of the crew members sick. There's now a police investigation into why infected passengers from the Ruby Princess were even allowed to leave that ship. Denham, you've carried out your own investigation. It will air this Sunday. What can you tell us?
We have, Matt, and this is no small thing. There are no less than 5 different organisations or authorities that dealt with the Ruby Princess coming into dock on that fateful day on March 19th. And by Sunday 7 p.m, we will be able to show who dropped the ball, who did the cover-up, why, how and when. And we've been talking about this now, and Mel is exactly right. These numbers that we are seeing, they are not numbers, they are faces, and 7 people have died from this ship alone. More than 400 people have been infected, and I've been speaking to the passengers that were on board this ship. I've been speaking to the people who have lost loved ones, and grandma or granddad went away on a cruise ship and they came back and they were dead within 10 days. And what I'm telling you now is this should not have happened. Some of these deaths that we're seeing in this new world have been preventable. But from this ship, it should not have happened. And I tell you that Carnival Australia will not be able to spin their way out of this one on Monday.
There are some serious questions to be answered. Looking forward to the investigation. Thank you, Denham.
From our borders at sea to those on dry land, Queensland has bolstered its state border closure with barriers and checkpoints to slow the spread of COVID-19. So let's bring in reporter Crystal Etherington on the Queensland-New South Wales border. And Crystal, how are these checks working?
Now, police have spent the day pulling over dozens of cars trying to enter the state without a permit. Last night, those tougher border restrictions were put in place around midnight. Officers set up barricades right around Tweed Heads and Coolangatta. At peak hour this morning, it was commuter chaos. Cars were backed up for kilometres as workers tried to get through. Police were even pulling over buses. One backpacker was refused entry into the state. There was even more drama this morning when police received a call that a man was trying to make threats to let off an explosion in the area. Officers have since revealed that man was making those threats 40 kilometres south from here, and they are tonight working to track him down.
Wow, Crystal, unlike scenes we've ever seen before in this country. Thank you very much for that update there. Now, the World Health Organization is considering changing its guidance on whether people should wear face masks in public following new research coming out of Hong Kong. So let's bring in our panel of experts, advisor to the World Health Organization, Mary Louise McLaws, and infectious diseases physician, Dr. Sanjaya Senanayake. Mary Louise, if I can begin with you tonight. Current guidelines advise that only carers or sick people need to wear masks. Why has this new research prompted experts to question whether everyone should wear one?
This is an interesting paper, and it's difficult to interpret because it's been tested against several human coronaviruses, which is not the same as this SARS-CoV-2 virus, although it is seen as similar because we assume that all these COVID viruses are droplet, and meaning they're large and they fall, and it's best to use social distancing, hand hygiene and environmental cleaning to ensure that we prevent the spread. But this paper shows that this virus has not just large droplets, but also small ones. But this shouldn't be all that surprising because even I've done some research with a PhD student, Dr. Jan Grolton and Professor Bill Rawlinson, and we identified that flu isn't just small particles, it's a mixture of both particles. And therefore, I think we can take home the message that most respiratory infections can express itself by one mode of transmission or another. And I believe that this findings is making us a little anxious because we're thinking, well, maybe we should be using masks instead of social distancing. So we still need to review this information and a few other papers that are coming through because, of course, it's a new disease and scientists are now getting out studies early.
It's the uncertainty, I think, here that's proving difficult for so many people. Sanjaya, we seem to have come full circle here. Donald Trump is now encouraging US citizens to wear face masks. In your view, are they effective at stopping transmission?
So, Matt, masks are definitely effective at stopping transmission. For this kind of infection, which transmits by droplets, a surgical mask is effective. We know that. And some data has come out from Cambridge University showing a couple of layers of cotton, like a T-shirt, seemed to work well. A Shenzhen hospital scientist had, 2 layers of a paper towel, which had some impact. So they do work. But we also have to remember that the other important spread by this virus is through droplets that have landed on surfaces, and we touch those surfaces with our hands and then contaminate our mouth, eyes and nose. So hand washing is still really important. The other issue is that the reason that countries like the US are talking about this is they have such a high burden of disease and their healthcare systems are struggling to cope. Quite different to the situation we have here in Australia. So in that sort of situation, wearing masks, whether they be traditional surgical masks or homemade masks, may have an impact on cutting down on the epidemic. Here in Australia, people would have to wear a lot of masks to get a slight benefit. Certainly in terms of the community, if someone is sick and they're going outside, I would definitely encourage them to wear a mask, but I don't know if we're ready for everyone in Australia to wear a mask at this stage of our outbreak.
All right, well, we'll wait to see what happens with those guidelines. Sanjaya, can I ask you, there's a county in central China that's been put under lockdown again after a second wave of cases have re-emerged. So will this continue to happen until we find a vaccine?
Mel, I think this could easily be the way, sort of a sort of suck it and see approach, because this is uncharted territory for us. If we look back to Ebola, we called the outbreak over when there were no cases for 2 incubation periods. So that was 6 weeks from memory. So we'd like to see 0 cases in Australia for 4 weeks before we're comfortable that there's no COVID-19 about. But the reality is, even if we get on top of this outbreak with all the measures that we've used, we'll probably still have small numbers of cases being confirmed every day or every few days. And with the economic consequences of the ongoing outbreak, the government will have a decision. Look, this outbreak seems to largely be under control. Can we now try and kickstart the economy by maybe opening restaurants this week and wait about 2 weeks to see whether there is an increase in cases or not? And if there isn't, maybe let's open travel to New Zealand and the Pacific Islands, etc. But if there's any rise in cases, they may have to pull back. So that strategy may well be relevant to Australia and other countries in the world.
It can be difficult to get a handle on when there are so many patients that are asymptomatic. Mary Louise, there have been calls for the government to release their coronavirus modelling. Why do you think it is so important to share this and to be so transparent with the Australian public?
Look, the Australian public have been taught how to be critical thinkers, and if you've got a population of nearly 25 million of critical thinkers, you need to then share and be very transparent with how you're making decisions, and decisions that require them to cooperate, such as potentially being in lockdown for 6 months. And models aren't perfect. They're based on assumptions, and there's a lot of assumptions that they can't put into the model, which may be okay. But in Australia, for example, most of our cases and our risks have been from international travellers. So it'd be very important to see how they've modelled to accommodate this new lockdown of the border. That we don't have that many unknowns, the local transmissions that we really don't know the cause. It's unusual. So if we had all of the variables that they put in, I actually think that the public could get on board and understand the importance of going with it, or actually challenge the assumptions, because it's a democracy, and we do best when we understand the rationality behind things.
Always, absolutely. Mary Louise, thank you. Sanjaya, thanks very much for joining us this evening. Now, they were used during the bushfires, and now a team of drones are being put forward to battle the COVID pandemic. And the man behind the venture is Ben Trollope, the CEO of Westpac Little Rippers. Ben, good evening to you. Just run us through the plan for the Little Ripper drones.
Hi, Mel. So the plan at the moment is to engage the Westpac Little Ripper team and the commercial drone industry across Australia to use innovative technology for new ways of combating COVID-19. In relation to sanitation, we can pull on a large range of agricultural drones that can spray disinfectant to public areas and alike. In relation to the drones that we've currently used over the beaches for the last 4 years with alert systems, we can actually remind people the requirements of government social distancing rules and regulations.
Yeah, how did you come up with it? And just explain the sanitation one. I mean, does it just shoot out a spray? How does it work?
Yeah, definitely. So our global partners DJI launched a massive fleet of drones in the peak of the COVID-19 pandemic in China. They sprayed 600 million square metres of public places and laid down disinfectant. So ultimately the drones are loaded with between 10 and 25 litres worth of disinfectant. And then it's almost just like a big spray tractor, yet it's airborne. So it takes the frontline human element out of it and allows the drones to go into that contaminated area and lay down a decontamination spray as if you'd like.
Is it going to go over people though? Are we all going to get covered?
No, that's not the plan. The ultimate plan, with the rules and regulations that are currently in Australia, and we are working with CASA and a lot of regulatory bodies at the moment to enable us to use this innovative technology. So from a standard spray capability, we would be looking to spray in the middle of the night or in the quieter times through public areas. But in relation to social distancing and alike, we would be looking to remind people constantly of the social distancing rules.
So just explain that concept of it for me. Does that mean the drone is hovering around us? Is that safe?
Yeah, absolutely. I mean, we've used drones on the beaches for the last 4 years in a range of different programs, and those drones have had speaker systems and alert systems for those last 4 years. To date, we've used them for shark monitoring and alerting people that there are sharks near them and to get out of the water. And we've used them also to stop people getting into trouble in rips and alike. So it is known technology. We have used it for the last 4 years. We're now just working with the surf life saving bodies to now enable them or give them another tool in the toolbox ultimately to enable them to remind people of the social distancing rules so we don't get repeats of what we're seeing on the likes of Bondi and Coogee.
Hey, the more tools to tackle this pandemic, the better. Ben, thanks very much and all the best to your team. Still to come, our experts pinpoint exactly when the pandemic will peak.
Coronavirus cons, the 4 scams you need to watch out for.
We're tracking the final mercy flights bringing Australians home.
And bedtime stories, Dolly Parton's gift to the children of the world. That's coming up on the latest from 7 News.
Well, now to the curve, and let's take a look at how Australia's rate of infection is tracking. Angela Cox has the details.
Mel, here are the numbers we need to know today. Australia now has 5,352 cases of COVID-19, 216 more people diagnosed. This graph is tracking the rate of new infections. As you can see, that's down again. So how is that curve looking? Well, you can see after a pretty steep incline, it is starting to flatten out. But where does it go from here? I want to show you some modelling that's been done by University of Sydney researchers. It shows just how important it is for everyone to embrace the social distancing measures. This blue line shows what will happen over the next 3 months if 70% of us follow the strict new rules. Cases will keep rising almost unchecked. Now, look at the red line. That's if 80% of us do the right thing. It's pretty good. But look what happens if 90% of us suck it up and stick to this very difficult way of life. The cases plummet close to zero. Now, a word of caution. The tail end of this shows what would happen if, after 3 months, we lift the restrictions too soon or too quickly. Just look at how that curve rockets straight back up. Matt.
Spells out why we have to be so vigilant. Thank you, Ange. Let's cross now to the professor behind the modelling research, Mikhail Prokopenko. Professor, your team has approached this from an engineering perspective. It's really interesting. What does this model forecast for Australia precisely over the next few weeks?
Well, basically we're looking to trace incidence and prevalence, basically the number of cases daily adding to the count, and also the active cases, basically all the infectious patients remaining in Australia. And basically what we try to find is under what conditions of social distancing, under what compliance you get the best control, best mitigation and suppression. And it looks like after some initial delay with adopting these measures, maybe between 21st and 24th of March, we switched to a more strict compliance regime and probably tracking at around 90% right now. So if that continues, then in about 2 weeks, maybe by mid-April, we should reach the peak of the active cases, and then a decline will probably start. Decline, however, would be a little slow, not as steep as the rise that we've seen right now with the numbers going up, because it's a different process when recovery is so slow while getting infectious is so quick. So it will take about 3 months after the peak probably to get to near zero, to almost zero number of active cases. Probably the model shows around July.
That's incredible, Professor. I haven't heard that we're so close to the peak here in Australia. It'll be encouraging, in fact, to a lot of people. So you're predicting that if we keep doing the right things, if 90% of us continue to self-isolate, by July 2020, this would be, in your words, under control.
Yes, definitely. It will be under control, but we shouldn't lose our focus here, and we shouldn't become complacent, because even if the numbers go to very low numbers, like almost zero, it's not immediately controlled, because there are some cases that may be not symptomatic and they could still be transmitting the infection. So for good measure, I would say another few weeks, even with near zero numbers, we should be following it well into July. Otherwise, this rebound that we've seen on these curves might indeed happen. I'm not saying it's unavoidable, this resurgence, and with better testing, large-scale testing, we should be able to catch and contain these new cases, but we shouldn't really relax seeing low numbers.
Well, that is encouraging indeed. Let's hope that people continue to do the right thing. Thank you very much to Professor Mikhail Prokopenko there. Well, we've spent a lot of time talking about how COVID-19 compares to SARS and why it's so much worse. Well, it turns out it's stickier. Imagine the SARS virus covered in superglue. This coronavirus binds to human cells 10 to 20 times more powerfully and is far less likely to be shaken loose. Here's Professor John Nichols from Hong Kong University explaining the phenomenon in a 7 News Facebook Watch special.
Structurally, it looks very similar, but it's got a slight change in what's called the spike protein. It's a spike protein which gives the name corona. And this change in the spike protein makes it far more stickier to cells than the ordinary SARS virus. So our hypothesis is that this increased stickiness leads to both fewer symptoms until a later stage. So it's structurally looks the same, but its function is far more stickier than SARS.
Now, while the majority of our COVID-19 cases are from international sources, there are still a surprising number of planes bringing people into Australia every day. We have counted 17 international flights scheduled to land tomorrow. That comes as it was revealed 16,000 Australians left the country after the Prime Minister warned us not to, and a further 3,800 left after overseas travel was officially banned. The government says there are still many citizens abroad trying to get home. So let's bring in travel expert James Wilkinson. James, nice to see you. International flight numbers do seem to have dropped slightly since we last spoke to you. So which airlines are still coming in?
Well, thanks, Mel. There's quite a few carriers still coming into Australia now. We're still seeing United out of the United States. We've got Qatar Airways coming out of the Middle East at the moment. British Airways out of the United Kingdom, Air New Zealand out of New Zealand, and Cathay out of Hong Kong. A few others on top of that as well. But in the last few days since we last spoke, the numbers are really dropping off, though. I mean, we're looking at load factors now. I mean, United's about 15.5% over the next 7 days. They were 28% when we spoke a few days ago as well. So I'm expecting between now and next Thursday, going off the booking systems I can see, there should be about 77 to 80 flights coming into Australia over that period, carrying around 2,100 people at the moment. These are aircraft that can carry about 24,000 people. So that's a load factor of about 8%. So it really is coming down very, very fast.
I'm just still staggered there's that many coming back in. There were that many leaving after we were told not to go anywhere, after it was officially banned. And also, I mean, I guess you've got no idea who's on board, whether they're Australians. I mean, can't imagine any visitors are coming in at this point.
No, I think I was thinking about this before when I was doing the numbers this afternoon, looking at some of the loads of the aircraft over the next 7 days. And looking at United, I mean, they're pretty stable over the next week. British Airways starts to drop off a bit as well. British Airways are about 14% over the next 7 days. But I think maybe because people know that they do have a few more days to try and get home, then they're going to be in isolation for 14 days when they get, maybe they're planning a bit more, knowing the seats are available. But remembering that late next week, British Airways stopped flying to Australia for a few weeks. So a lot of those flights are going to start drying up. Cathay Pacific now down to just 2 or 3 flights a week. Air New Zealand have even dropped even further down to some of their Australian flights. Their flights are still averaging about 49% coming across the Tasman to Australia, so a lot of Aussies coming home. But again, in the next week, 2,100 people out of aircraft that normally would be carrying about 24,000. So wow. It is quite a big drop, isn't it, from what those planes were when we were all packed in as sardines on board. I'm glad to see they're doing social distancing on board those aircraft as well, where they're spacing people out.
Yeah, let alone the queues to get on and all of the other things. Well, hopefully every last of them will hurry home. Like, just everyone get home.
I think so. Yeah, well, there are a few ways to get home. So Aussies do, know how to get home at the moment. The one thing to put in perspective, there's only 23% of the available seats as there were at this point in last year. So 75% of seats are not available anywhere in the world. So that's a huge drop from what we've seen in 12 months.
Yeah. All right, James, thanks for that. Thanks for crunching those numbers. Talk again.
Well, still to come, scammers are preying on coronavirus anxiety. How to make sure you don't get fleeced.
Will the NBN cope with the added pressure of people working from home? We ask the boss of Optus.
And later, Dolly Parton's special goodnight gift to kids all over the world. That's coming up on The Latest here at 7 News.
We're a company and an industry that does the right thing.
A breeding ground for the largest cluster of COVID-19 cases in the entire country. From here, it's spread out to every state and territory.
Did anyone explain that perhaps the virus was on board?
No.
This ship will be at the centre of a huge inquiry.
This email is the smoking gun.
Who knew about it and how it put every single one of us in danger.
The Ruby Princess Outbreak Unleashed, Sunday at 7 on 7.
Well, if you think your internet speed is slowing down, there might be a good reason.
All of the extra calls and video conferencing we're doing to stay in touch and stay in business, combined with online streaming, is putting extra pressure on telecommunication networks. To help ease the burden of our pockets, the big telcos, Telstra, Vodafone and Optus, are offering most customers unlimited or extra data for the rest of April. But can the internet handle it? Optus CEO Kelly Bayer-Rosmarin has been watching the surge in usage, and earlier I asked her how the system is coping.
I'm really proud to say that the Optus network is staying strong. Data usage has gone up by between 10 and 15%, but our voice usage has been the surprise, and that's gone up by about 20%.
Well, that's good. So everyone's staying connected and chatting and talking to one another, which is nice to hear. We've seen some other telecommunication services hiring more people. Are there plans for you to do the same?
Yeah, we're definitely hiring people at the moment, especially working with some of our partners who have been badly affected by these difficult times, so partners like Virgin, and we've already onboarded about 300 new staff locally to help us with our customer care.
We've seen Optus react to a number of relief packages to get through the hardship of the coronavirus, but there is something new, isn't there, for health workers?
We know that healthcare workers are out there supporting us, and so we wanted to do something to support them. And what we have done is decided to waive the mobile fees for healthcare workers, and we'll do that for the next 3 months so that they can concentrate on looking after all of us.
Any tips for families when you've got, mum's in one room working and the kids are doing school in another and someone else is downloading their favourite show? A lot of demand in a household. What would you recommend?
Yeah, well, I can definitely relate. I'm one of those households where I'm constantly on Microsoft Teams or Zoom, and both of my daughters are doing their schooling being live streamed. So we're all using things at once. I think just have faith. The networks are built to withstand peak traffic, and so far they're holding up well. So if there are things that you can do overnight when nobody's using the network, such as downloading all of your favourite shows that you want to binge watch, if you do those downloads overnight, then it just alleviates some of that simultaneous usage and makes the internet faster for everyone in the household to enjoy.
Happy to hear that, Kelly. Thanks very much. Appreciate your time. And here are a few more tips. If your internet is slow, you can turn the router off for 10 seconds, then turn it back on, and this reboot should help. Test your speed with a speed test app. If it's slower than what you think you're getting, you can contact your provider. And as Kelly said, download movies and shows in off-peak times. Maybe do it in the middle of the night while everyone's asleep to free up usage during the day.
Well, we wanted to show you a lighter moment from Perth today. We're seeing restrictions being enforced in different ways across the country. The WA Premier was asked about the case of a New South Wales man who was fined $1,000, spotted sitting on a bench eating a kebab. Take a look at Mark McGowan's response.
I find it hard to believe someone was going for a run and then stopped to have a kebab. But in any event, they do things differently in New South Wales. There's nothing wrong with... There's nothing wrong with going for a run. There's nothing wrong with going for a run and having a kebab. But I don't think there's anything wrong. We're not making it unlawful to go for a run and eat a kebab. It's whether or not you're in a group. That is the issue.
This is the best press conference I've seen for quite some time.
And probably not a phrase he's ever thought he'd say.
No, not in a hurry. I think it should be enacted that is okay. Kebabs are all right, but keep
After
moving.
A run.
Keep moving. Still to come, from fake online stores to dodgy text messages, the new wave of scams taking advantage of people's coronavirus anxiety.
And how would you like a celebrity to put your kids to bed?
Are you ready to read this special book? Well, here I go.
Dolly Parton's gift to children and parents stuck at home. That is next on the latest from 7 News.
Australians have lost nearly $90,000 in just the past 2 weeks to scammers taking advantage of the fear and anxiety surrounding the coronavirus pandemic. Scam Watch has recorded hundreds of reports of fake emails and websites attempting to trick people into handing over money or personal information. I asked Deputy Chair of the ACCC, Delia Rickard, what we should be wary of.
These people are the bottom of the barrel, and we're seeing an explosion in scams related to COVID-19. Some of the ones to look out for, we're seeing scams impersonating government departments and the World Health Organization. They might be trying to get access to your personal information. They might be trying to get access to your superannuation. They might be promising you money. It's really important when you get contacted out of the blue, no matter who they pretend to be, not to give away personal information, not to click on any links which might contain malware. And if you think it's real, go and call the organisation or contact them directly using information from Google or the phone book. We're also seeing sort of a mass swamping of the country with scams pretending to be Woolworths or Coles, offering you a $250 voucher, and we suspect if you click on these particular offers, what you'll get is malware downloaded onto your computer. And of course, we're seeing lots of online shopping scams with people who are desperate to get toilet paper, face masks, alcohol wipes, those sorts of things. They're often charged quite a lot for them. They send it off and nothing turns up.
Now, one of the key aspects of this scam, I guess the potency of all of this, is that they appear to be from an official source. How do you actually spot one?
They're really hard to spot. A number of the things that have been reported to us have turned out to be real. What we're doing, though, when we see any of those government impersonation scams, we're letting the relevant department know, and we're working with the Australian Cyber Security Centre. We let them know, and they're doing an incredibly good job of getting those scams taken down and removed.
You described, I guess, the flood of scams here as an explosion, which is a really worrying term. Are people actually falling victim? Are they losing money?
We've had, I think about 700 reports in the last fortnight and over $88,000 worth of losses reported to us. So we're starting to see some decent-sized losses. We're also very concerned as people try to pretend to be helping people to get the job seeker allowance or early access to their super, and do not, whatever you do, give away personal details, particularly access details for your banking accounts or your super accounts, to someone who contacts you out of the blue. It's just really important to remember that.
It's important and, in fact, critical advice. Delia, thank you very much for your time tonight.
You're welcome, Matt. Take care.
Talk about the lowest forms of life. It's hard to believe anyone would see this virus not as a threat but as an opportunity.
Yeah. Now, still to come, something to make you smile. Bedtime with Dolly Parton.
And I'm going to be reading a very special book today. This is called The Little Engine That Could.
The Queen of Country helps your kids get to sleep. That is next on the latest from 7 News.
It's pretty clear now is the time to share a story and share some love. These are the wise words from Dolly Parton, who launched her new YouTube series, Good Night with Dolly.
The country music superstar is working well past 9 to 5, live streaming children's bedtime stories, and she kicked it off today with The Little Engine That Could.
Hello, I'm Dolly Parton, the book lady from the Imagination Library, and I'm going to be reading a very special book today. This is called The Little Engine That Could. This book is so special, it's celebrating its 90th anniversary. It was written by Waddy Piper and illustrated by Dan Santact. Are you ready to read this special book? And the little blue engine smiled and seemed to say, as she puffed steadily down the mountain, I thought I could, 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 I thought I could. Isn't that fun? I even wrote a song about this little book. It goes, woo, 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 woo. I can do it, so can you. Woo, 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 woo. I believe in you. And I do, too. Good night.
Oh, come and tell me you're smiling. Well, from Tennessee to Tamworth, the library in country New South Wales is part of Dolly Parton's Imagination Library program, which sends free books to children. And I spoke to Kelly Makepeace from the Tamworth Library a short time ago. Kelly, tell us about the Baby Book Time program.
So the Baby Book Time program is one of our children's programs at Tamworth Library, and it's connected to a bigger program called the Tamworth Dolly Parton Imagination Library. All babies that were born from last year are eligible, and they receive a free book every month in the mail until they turn 5, so that's 60 books. And to support the parents who are getting the books at home, we do Baby Book Time, which uses the Dolly Parton books they've received in the mail and just shows them some simple strategies to get the most out of the experience in terms of their children's language development.
I love this idea, and I love it that suddenly we're talking about children reading and Dolly Parton in the same sentence. But explain to me now what's happened, because you've taken it online. How's that working for children and their families?
So today we actually launched our online Baby Book Time programs, and when we put out to the community last week that we were going to do this, we got something like over 3,000 views. And normally, face-to-face, I can only see maybe 10 to 15 parents at a time, and it's so in demand and I can't fit everybody in. So it's potentially going to be an even better service.
Wow. So there's the silver lining, I guess, that the program is extended at a time when we're all talking about the importance of being connected, about doing things together. Just how important is something like this program and reading?
Our programs are really interactive. So in the online version, I've got a little doll and I'm encouraging the parents to put their own little babies on their laps, doing the movements with their babies, reading the books, bonding with their babies, just as they would if they were at a regular baby book time. It's so important to keep doing that from birth. We know that, the research tells us that. But in this time, I think what more could you want than bonding with your baby or helping your children, being their first teacher and taking on that role. I think that is the silver lining, certainly in this situation.
It's lovely. We'll all have to practice our storytelling voices and our animal voices to bring them to life when we read these. But it's such a lovely idea. I'm glad that it's working so well. And all the best to you, Kelly, and all the kids that are taking part in it.
Thank you, Mel.
What a wonderful initiative, and in heartwarming scenes similar to those we've witnessed around the world during these harrowing times, a group of New York firefighters have assembled to thank the medical staff at the Elmhurst Hospital in Queens. Their applause, a sign of respect to the healthcare workers who'd been working so hard and risking their lives as the pandemic grips the globe. Well, your Saturday weather forecast is next, the latest here at 7.
Well, welcome back. We are going to take a live shot of the Maldives tonight as we continue to take you to all the places that you can't actually get to as we tour the globe at toasty 32 degrees right now. And taking a look at the weather around Australia, Sydney, clouds clearing and 28, showers easing in Hobart, mostly sunny in Perth and 27.
And in other parts of the country, a possible storm for Chinchilla, showers 21 in Mallacoota, and in Humpty-Doo, a top of 34 degrees.
Well, we were saying it's only 5 days since those tougher restrictions came in where we had to cut back crowds down to 2. So much has happened in 1 week, and this weekend is going to be unlike one we've ever experienced.
Still doesn't quite feel real, does it? But there is some small light at the end of the tunnel with Sydney University saying today if we keep doing what we're doing, then we could at least bring things under control by July.
I hope so. All right. Well, thank you for your company this evening. So from the team here at 7 News, that's the latest. I'm Melissa Doyle.
And I'm Matt Doran. Good night.